to welcome our next presenter and the facilitator of our BMD patient panel today, Michelle Taylor, MCCRC. Michelle is a board-certified rehabilitation counselor. She earned her MA at Western Washington University and has been a longtime resident of the Pacific Northwest. Michelle's clinical interests include an emphasis on patient empowerment, recovery, and the building of support systems. She utilizes assessments and patient self-report to discover potential strengths that may act as a catalyst for progress or subsequent barriers that may impede preferred activities of daily living. Michelle has a short presentation on BMD in the workplace, and then she will be shifting to our patient perspectives panel. Hi, Michelle. You're here?
I'm here. Hi.
Wonderful. Hi, thanks so much for joining us today. I will go ahead and stop sharing my screen so that I can pass it off to you.
Sounds good. All right, I will pull up my presentation and we'll get through that. Let me get that ready here. And I will share it. One moment. Let's see, there we go. Okay. Get this running. There, okay, go back to the beginning. Okay, hopefully that is visible for everybody.
Looks great, thank you.
Of course. I am excited to be here today. I think that this presentation, will be helpful in certain ways because a lot of times the workplace stuff isn't talked about quite as much. And usually what I focus on in my presentations is the aspect of, kind of when things get more difficult at work and how to accommodate or, if exiting work is needed, how to, benefit from the process and use the, those benefits that are available to you. So that's kind of what I want to focus on. And I will try to go through it fairly quickly so that we can have enough time to do a good panel. So I titled it, BMD in the workplace, managing the impact of, excuse me, of, I don't know why this is, a second here, health changes with Becker Muscular Dystrophy on employment and life activities. So I will just go ahead and go to the next slide. So I'll kind of be going over a little bit of information on work-life health balance, as well as some accommodation information, when to disclose disability with work, employment rights, when to exit work and the benefits that are included or connected to that, and then some disability resources at the end. And I'll speed through a little bit if we get short on time. So just to begin with, what is rehabilitation counseling? And that's what I do, but it's not super common out there. There's only a few of us in Washington State where I'm at. So we're kind of the professional counselor that are trained to serve people with different types of disabilities or chronic illness, severe injuries, those kinds of things. And we're often focusing on the impact of those, health changes on employment and education, or also looking at evaluating strengths and functional limitations related to what's going on health-wise, and then also evaluating some of the, medical, physical, psychological, cognitive stuff going on as well. We also talk about adjustment to disability and, understanding the medical and kind of psychosocial aspects of that. Sorry, my PowerPoint keeps jumping ahead. Well, it's doing weird things. Okay, I'll go to the next slide here. Yeah, and I do work in a hospital setting, so oftentimes I'm seeing either patients regularly who have long-term chronic illnesses that have been going on, or I'll see individuals who are coming out of inpatient care with new chronic illnesses that are then going on. And then this is just more about rehabilitation counseling. We do, career exploration and vocational assessments when somebody has been in a job for a long time, and all of a sudden they cannot do their job anymore because of their disability. Or things like, just getting information to a person about the ADA, Americans with Disabilities Act, or how to use medical leave and stuff like that. So work-life health balance. So some things that are important about, the balance between working and your life and health and such are thinking about what your quality of life is, kind of how you see yourself as a person and how your identity relates to your work. Also, kind of what physical shape you're in as far as health-wise and your emotional health. We also kind of look at financial security and your benefits through healthcare, and then, how a change in employment would impact you or your family. And those are kind of the connections between how work relates to life and how the health kind of gets mixed into that as well. And I bring that up because, it's important to decide when you want to disclose that you have a disability, if you need accommodations or if things are getting difficult at work. So when you are having issues with your job, there's a few signs usually that are going to show you that it might be time to kind of figure out, when do I need to disclose or do I need accommodations? And things like that are job performance problems, physical demand issues, exceeding your ability to do those tasks and such, your level of fatigue, not, allowing you to perform duties anymore that you used to be able to do, productivity issues, attendance issues, feedback that you're getting that things aren't going well, or other things, and I jumped ahead again. Additional issues could be that, you've been given a performance improvement plan, which means that, there could be disciplinary action after that, or there could be more warnings coming, things like that, that show that you might want to start planning strategically for kind of your next steps around employment. And there's some other things listed on here too that are important to think about, like talking to human resources and such, or if you're knowing that your job is in jeopardy, absolutely, and that you have a short amount of time to kind of try to turn things around. So we always like to say, if you're having job challenges, you don't have to panic or make any quick decisions. Basically, you're wanting to kind of, think about what your options are, not immediately quitting, but more considering, if you need to change jobs, if there's another position within the company that could work, or if you could go on light duty. There's a lot of different options, and those are the things that a lot of times we're counseling people on as rehab counselors, dealing with workplace issues. And then another component to this is, seeking guidance from your medical team, and, knowing what the level of urgency of the situation is, so that the clinic can kind of help evaluate that, and you can get kind of full interdisciplinary care and figure out treatment goals, related to symptom management, if there's some sort of, physical therapy, or medication that could benefit you, or other things that could be done that would be helpful. And another piece of it is to start collecting the information about benefits and your kind of work options, which we'll go into a little bit more here as we move on. So disclosure, job protection, and disability rights. So you are not obligated to disclose your health condition. And this is good to know just for interviewing as well. If you're interviewing for a job, we suggest that even if you're going to need accommodations, you wait to disclose until you've been offered the job in writing, to prevent any sort of possible discriminatory practices, because then your position can't really be pulled from you without any particular reason, which sometimes will happen. Not super often, but often enough that we like to suggest to wait to disclose. And then also, disclosing just more randomly to a manager or supervisor we don't suggest that so much either, because usually it will go through human resources in an official accommodation letter through us. At least that's kind of how we do things at the hospital. And then the rest of the slide is just kind of about when you want to really accommodate things, and it should always be related to an employment need. So and only what is necessary, as sometimes you'll find that you talk to human resources and they'll request a disclosure for you to sign a release of information for all of your medical records rather than just the information they need about your particular disability. And so we also suggest not to allow for an employer to look at all of your medical records of all time, kind of thing, which is what they could do if they get that signed release of information. And then this is an interesting thing, and I always want to kind of point this out. So can my employer fire me if I have a disability? They can, because you still have to meet the essential functions of the job. So if you're not able to, do your regular tasks or, other things like that, and accommodations are put in place and you're still not able to do them, you can lose your position that way. But if accommodations are put in place and then you are able to do your work, which is, usually the point of accommodations, you're fine. So I just always point that out because sometimes there's a kind of a misnomer out there that just because you have some sort of condition of such, you're protected. And I wish that was the case, but it's not as much of the case, although the ADA helps and those job accommodations are helpful as well. And then this kind of explains what I just said, so we could probably skip through this part of the slide. And then here's more practical guidelines around disclosure. We don't suggest to disclose to coworkers. Obviously, totally fine to talk about things with family, friends, people that you're close to, all of that, but not so much with, other workers and things or supervisors, because it's really not their privileged knowledge to know. And then there's a few other things on this slide, such as thinking about temporary accommodations like light duty, where let's say you work in a full-time position, but you have some, sort of flare up of things and you need to take a month or two off of work, and then you need to return with less hours and eventually work up to your full hours. That could be kind of a gradual return to work or a light duty type of situation. So there's a lot of different ways that you can accommodate positions. And then if you're in a situation where things are not going to improve in this particular job and you're going to need to get a different type of job or, move into a long-term benefit, then at that point, there's a few things to do, and we would consider it kind of an early intervention situation where you would want to contact your healthcare team. Still wouldn't advise quitting a position because it's usually always better for an employer to end a position rather than the patient to do so. And one of those reasons is that, if you have medical coverage and you're ending your position, then you've just cut off your medical. Whereas if you let your employer do it, then you can continue with that medical coverage until the job ends. And then there's also the requesting of medical leave and how to use things like FMLA, Washington PFML, short-term disability and medical and rehab services. And this is, once again, this is Washington stuff. So this is on employment rights. So Family Medical Leave Act, FMLA, is a federal program that provides you with 12 of the work weeks of unpaid leave. So This benefit protects your job during those 12 weeks, but it doesn't actually pay you any part of your wage. And then also it protects the health insurance benefits as well. So you can use it continuously, whereas you would take a month or 2 months or 3 months all at the same time, or you could set it up to be used intermittently through an accommodation where maybe you're using it 1 day a week that you need it, depending on how things are going. And eligibility includes, having a serious health condition that makes employment, not performable and such, as far as the essential functions of the position, and an employer has to have at least, 50 plus employees to be able to supply it. You also have to have worked for 12 months for the employer as well, and so many hours. Now, ADA leave is a little bit different. So I'll go into this a little bit. Oh, wait a minute. There we go. So it is an accommodation-based leave when someone doesn't have the FMLA available to them. So employers that don't have the 50 employees, or an employee that hasn't worked the 12 months or less than the 1,250 hours could essentially access the ADA leave if they get that accommodation. Or it could go to someone who did use the FMLA, but it's all gone. The thing is that the ADA leave is time limited, and it does not cover any, financial benefits, so it wouldn't pay any of your wages as well. And then for Washington, the Washington Paid Family and Medical Leave, that's part of Washington's Employment Security Department. It's also 12 weeks of paid leave. It can also be taken continuously or intermittently. It does not protect the job and benefits, which is why oftentimes someone will take the Washington Paid Family Medical Leave at the same time as FMLA, so that their job is protected and they're getting paid. So that happens fairly often. And that coverage can be for you or for a family member that's helping care for you for whatever reason. And you only have to have 820 plus work hours in the past year to be able to qualify for that. So what are your employment rights? So there's the Americans with Disabilities Act, the ADA. There's the Federal Civil Rights Protection for Individuals with Disabilities. And then, prohibits employment discrimination. And there's that protection with an employer that has more than 15 employees that is required to give accommodations. Less than 8, they do not have to. So it's kind of, at least in Washington State, kind of an interesting thing. And then I'm going to go into some of the insurances. So private insurance and Social Security. Private insurance is usually something that you pay your employer to have running for you in your every paycheck. And there's usually short-term and long-term benefits available. So when you hear of short-term and long-term disability, that's kind of what we're talking about. And there's a few different times when it's important to apply for that. One of them being if for some reason your job that you've been at for a long time is going to drop down to a position at lower pay or some such change, because then the benefit you would get from the long-term disability would also get lower. And that's kind of something that you would want to talk to someone more about specifically at the time that it's happening, probably like a rehabilitation counselor or someone similar, to kind of tease out what the best options are at that point. And then Social Security, that's a federal program through the Social Security Administration, and there's supplemental security insurance, and then there's Social Security disability insurance. So there's SSI and SSDI. So along with the private insurance, the long-term disability, It is something where you are protected within your own particular occupation. And the best way for me to kind of explain this is that the difference between long-term disability and Social Security disability is that you can get onto long-term disability if you can no longer work in your current position, whereas you can get onto Social Security disability when you can no longer work in any position. So that's kind of the difference. And so that's kind of what I point out. It can be also under mental health conditions, which doesn't last as long. I'm usually only two years ish, at, if that's how that was qualified for. But traditional long-term disability with other disability issues can essentially last until you retire, depending on what the situation is. And sometimes those long-term disability policies ask you to apply for Social Security at some point as well. So, and hopefully there can be questions in the chat if things are coming up as I'm going through this that I can address later and such. And then here's a few resources that I have. So the Job Accommodation Network is a website that kind of shows a lot of information on, you can, click on, muscular dystrophy specifically, and there's a lot of different possible accommodation options, because sometimes it's hard to just come up with, what accommodations could I actually use, or what's out there that people get. And so that's a really good use of this website. And there's other parts to it too that I think are really helpful. And then this is just a little bit more information on Jan. And then the Division of Vocational Rehabilitation is a vocational agency that's state and federally funded, and they are all across the state of Washington, but they're all across all states. They're mandated by the government through disability to be available. And what they do is they help people with any chronic illness or disability issue to address return to work, return to school or training. They help with, if you're in a job and you're struggling and need to try to maintain it, keep your job. They have contracts with other vendors that can come in and help with that. They also have assistive technology specialists that do evaluations and other functional evaluations that can be done, so that you can figure out if you need to change careers or if you need to kind of retire out of your career. You can get evaluated and get more information on that. And depending on your financial eligibility, or if you're on Social Security benefits or food assistance, things like that, they can actually pay for retraining and full college degrees and things like that. So there's a lot of different benefits there. Yeah. And I think that, and that's more on that I just said. I think I probably covered those. Other than the community-based assessments that are listed on the slide, there are when you actually go into a workplace and kind of, try out a position and see how it goes. That can be helpful. And then here are just some other links to resources that are good ones. I think that's it. Let me just double check. There might be one more page of resources. Yeah, 2 pages of resources, a lot of Washington ones there. And then we can get to the panel. Yeah, okay.
Thank you so much, Michelle, for your presentation. It looks like we do have a couple questions in the chat, but I think we should move on to our patient panel, and we can answer those questions after the panel. Maybe we'll get a few more questions for you in the meantime.
Okay, sounds good.
Wonderful. So yes, moving right along, we do have a patient perspectives panel for Becker Muscular Dystrophy. We're really grateful to have three gentlemen joining us today. We have Patrick, Nevin, and John. I will go ahead and pass this back over to Michelle, who will be fielding some questions, and I'll let those gentlemen introduce themselves for our first question. Thank you all so much for being here today.
All right, excellent. Yeah, well, yeah, we will start with the introduction. So just because of the way my setup is with Zoom, I see Patrick on there first. So we'll start with you if you don't mind. Just
All right, no, not a problem.
um,
Pat Cusick. I actually work for the MDA. I was diagnosed with Becker right after I turned 30, so about 17 years ago. Let me see, yeah. So, and I've been lucky. I live in Columbus, Ohio, right down the street from Nationwide Children's Hospital. So I've actually been fortunate enough to be in two clinical trials, and I was actually in the follistatin trial that was referenced earlier.
Great. All right. And then let me jump over to John.
Hello, hopefully you can hear me. I'm John Bruns. I live in Ham Lake, Minnesota, which is a suburb of the Twin Cities, Minneapolis, St. Paul. I was diagnosed when I was, I think, 24 years old, and I'm 56, so 32 years ago. Um, and I have a degree in accounting, so I've been working in accounting and finance since the beginning or end of college. And I've actually worked for the same company, which is a medical device company locally here for over 30 years. And yeah, that's me.
Great. Okay. And then Nevin, we'll jump to you.
Hi, I'm Nevin. I'm from Connecticut. I'm 41 years old. I was actually diagnosed when I was 6, which is early. I work as a video producer at ESPN because I couldn't play sports. I turned my life into a career of producing sports. I've been doing that for 18 years. I have family, 2 kids. They get to play sports instead of me. And also, like Pat, I have been in a couple of clinical trials.
Awesome. Thank you. All right. Well, I will just jump into the question. So this first section is kind of about like at home care, daily living stuff, those kinds of things. And we may not be able to get to all the questions, but I think we'll probably have time to do most of them. What daily routines or habits do you feel like you have found most helpful with managing BMD? And I mean, any of you can jump in or I can call on you, whatever works.
I would say the one habit that it's taught me is to plan. Plan for everything you don't expect, and look ahead. Like I've talked about before, like Googling a restaurant to get an outside picture to know if you're going to have to deal with steps or not, that sort of thing.
I think 2 things for me. One, when we decided we needed to buy a house without stairs, we made sure before something bad happened that I couldn't actually use stairs or I needed mobility devices to make it all accessible ahead of time. And also, when I go to work, probably for about the last 5 years, someone comes out and helps me with whatever I need because I know I can't do it myself. And that's really helpful to make sure that I'm safe and I don't have to carry all of my stuff into work and whatever mobility devices I'm using.
Makes a lot of sense. Anything you would add, John?
Yeah, I mean, so one thing I try to, as much as possible, like I'm still somewhat ambulatory, so I can stand and walk real slowly, but try to get on my feet several times a day, try to do some basic stretching. Um, and then, yeah, don't be afraid to ask for help. I failed to mention, I have a daughter and a wife, so my wife helps me out. Um, I don't have any outside caretakers or anything like that, but just I try to remain as active as I can while being safe. Obviously, I'm not trying to do things that would risk falling or injuring myself, but just to try to be active as possible.
Yeah, that makes a lot of sense. Okay. And then my next question is, how do you manage the fatigue and muscle weakness in kind of your everyday life? And what strategies would you say help you stay active?
So for me, something that happened recently, I have a scooter, but I also just have walking sticks that I'll use. And I realized the walking sticks weren't enough because my balance wasn't great. So I adapted and I got a rollator or walker so that I would have something to hold on to at all times and be a little bit safer. And also, the big thing for me is like knowing that if I'm tired, I just have to stop. I can't keep going. I need to tell myself, time to lay down, and make sure that before I go to bed, I stretch as much as possible, because that's a good time to do that. And it helps me sleep a little bit better. So just, preparing to avoid the fatigue.
Yeah. Yeah, I would agree with that. Like listening to your body is super important. I mean, we all know when we're pushing too hard, and when you get there and you start feeling that burn, you gotta time to, settle down. And then yeah, and just being general and tired. I mean, you guys know when you're walking and you're a little tired, I mean, it throws that balance even more off, and it's makes things difficult. But I agree, like stretching before bed, super important. I do that as often as I can. And water. Everyone got to stay hydrated. Hydration is so important, because it's important to muscles, and we only have so many, so you got to take care of those.
Mm-hmm. Yeah.
Yeah, I don't have much more. I mean, those are great thoughts and hints. Yeah, just know your body. I think when I was younger, I pushed it way too far, and the point where I could barely move. But now I think the older you get, maybe the wiser you get. But yeah, I definitely have learned to get to that point. You just gotta stop, even if you're in the middle of something. So those are great points.
Excellent. All right. And then my next question, I'm going to move into kind of building community and finding support. How important has it been for you to connect with others who have Becker muscular dystrophy, and how did you find those connections?
I think it's pretty important to me. Go ahead, John.
Well, I was just going to say, I mean, I'm through the MDA various events. I've met a few people who have Becker's also, at MDA Engage events. And I've kept in touch with some people from out of state via phone. And I'm also part of locally here, we have an adult networking group, and it's not just for Becker's, it's for any neuromuscular disease. And so that's a really helpful group because we share our good stories and our bad stories, and what helps each other as far as devices and things like that. So I found it really helpful to engage with others that understand you.
Mm-hmm.
Yeah, I would say when you get 2 or 3 Becker guys together, the first thing we do is compare our fall stories. And it's because we get it, like it's just something that we can understand. And I think John makes a good point. Like knowing that there are other guys that have gone through the same thing, I think helps. I mean, with any disability, it can be isolating. So to know other people that are going through it, and now, with the internet, social media, able to keep in touch with people. And I would say I met most of the guys I know through conferences, either MDA or the other organizations. And actually, if you like being in the clinical trials, you run into people when you're at the testing site and you start chatting, and like, when I was diagnosed, there still wasn't a whole lot of research for Becker. So part of the DMD groups as well, just getting to know some of those folks because a lot of the same resources apply.
I agree with what's been said, and I've connected with Pat a couple of times through different things. But the MDA, lots of resources. Plugging a different organization, the Parent Project, has helped me out a lot because they've got a lot of young adults that get together, going to all the events. And it's not just Becker, it's every different disease out there or handicap we can learn from and help each other. And social media, Instagram, Facebook, just, hey, click, got a question. And you become friends with someone and you can just tell them you're having a bad day or ask them, hey, should I really get a scooter? what's it like? You have one, I've seen pictures, and posting my story online, other people reach out and they have questions too.
Yeah, it is kind of crazy how that has really broadened the amount of support that can come out and connection and all of that. So it's pretty cool. And then my next question, let's see. I mean, this is kind of really related to what we just talked about, but what kinds of community or virtual resources have you found most helpful, and how did you discover them?
Yeah, I think, I went online. Like everybody else who gets a diagnosis they weren't expecting, you Google it, which I always recommend against, because until we get the search engines to put the good stories on the top of the list, it's a bad idea. But I mean, I did, and then MDA was on that list as probably one of the first places I went. I talked to my doctors quite a bit. I was fortunate to have some great doctors, like Dr. Mendel. So knowing about resources, I definitely went through them. My physical therapy team has been amazing, and they've definitely recommended some things for me and set me in the right direction.
Great. Anything you guys would add to that at all?
I don't think so. I think it definitely, the one thing I can add is that when you go to a clinic that has all the resources, usually they can point you in the right direction for a lot of different things versus, maybe a doctor that is seeing patients across the spectrum of different neurological diseases a little bit harder, but those clinics have so many resources.
Yeah, that's true. All right. And then, what advice would you give someone newly diagnosed about finding, community and support?
Maybe I can
Go, Jen.
take this or start. No, on my journey, first of all, when I was first diagnosed, there really wasn't any social media or Facebook or any of that. And everyone has their own journey, but the advice I'd give is don't be afraid to kind of not, I call it embrace your disability, but get out there and find other people with. I kind of went into like a 10-year denial period when I was first diagnosed and didn't really tell anybody. I mean, you could tell when I walked, my gait was off, but I wasn't in a scooter or a wheelchair or anything like that. But I've just learned in the last, since I've opened up more, it's been a much easier journey when you can find other people that you don't feel like someone mentioned, you don't feel isolated, like you're the only one in the world that's suffering from this. And so I would just, when you're ready, I'm not going to tell people when and what to do, but when you're ready, seek out like Facebook groups or, other people, because there's a lot of people out there. I didn't, with living with Beckers and all different types of stories and people with different careers and such. So that would be my advice.
Yeah, I definitely agree with that, and I can relate. I mean, there was a couple years after my diagnosis where I was definitely in denial, and wish I could have get those years back and treat it a little differently. But I get it. I think just don't be afraid to get out there and talk with people. I mean, because other people have been on the journey. It may look different, but a lot of it's the same. And I think just talking to other folks that can relate always helps.
An additional thought on all of that is if you are newly diagnosed, don't be in denial, don't hide behind it. Really put yourself out there to get the care that you need and talk to people in the community that can help you, that have gone through what you're going through. But when I was, I progressed probably about 7 to 5 years ago. And at first it was really, I don't want to tell anyone. And then it became, well, it's going to be a lot easier if I do.
Exactly.
Yeah.
Makes
It's a lot better than people think you're drinking all the time. Yeah.
Goodness. Yeah. I think this is going to be really good information to be out there. And then my next question is more related to engaging with your medical team. So What advice might you give someone who is newly diagnosed and in just the beginning of establishing relationships with their healthcare providers?
Don't settle on your healthcare providers.
That's it.
Look around. If you feel like you're not getting the information or the help that you need, find someone else that can help you. Ask the right questions. Sometimes they won't think about something that you need. But if you say, should I be doing occupational therapy, physical therapy? Should I try a scooter? They'll be like, oh, that is a good idea. So you got to speak up for yourself.
Mm-hmm. Yeah, feel comfortable. Like if you don't feel like you can ask straightforward questions and respond honestly with your physician, that's not good. Like, yeah, definitely don't settle unless you're perfectly comfortable. I mean, I switched doctors after I was diagnosed just to someone I felt more comfortable with, and yeah, don't settle. That's great advice there. It's your health, it's your life. Make sure that the people you're working with take it as seriously as you do, and you feel comfortable talking with them.
Yeah. Anything you would add, John?
No, I concur with what
Good.
the others have said. Yeah.
Yeah. That's one thing that I advocate for patients all the time is because oftentimes somebody is coming to me for, specific things, but then have, 8 or 9 other providers in different areas. And they say, oh, I'm not really getting along with this one. I say, well, you can maybe think about exploring others if you need, because you want to be able to trust who you're working with.
Yeah, maybe one comment is, I benefited from, there's an MDA care center where I live, but going to the same clinic for seeing a cardiologist, seeing a neurologist, physical therapy, not having to go to 5 different buildings, and then you're in this kind of the same clinic. I think in most cases they talk to each other a little better than being in different health systems. So I found that successful. And if you're not happy, go. I went to the Mayo Clinic just to get another idea when I was earlier in my diagnosis. So that was always helpful. So don't just settle for like Patrick said.
I think that's a good one. And then this is the last question I have. So, how do you stay informed about new treatments or research related to Becker's muscular dystrophy, and how do you communicate this information to your doctor or medical team?
Well, I'm lucky because I work for MDA, so I'm pretty up to date on a lot of it. But prior to that, I mean, clinicaltrials.gov is a good place to check for things coming out. And I mean, there's there's MDA. You got the Quest newsletter that has some good information in it. There's recently a lot of muscular dystrophy news. I've seen some articles lately from. Yeah, it's typically few newsletters and websites that I check regularly that have that information.
All of my information has actually come from the doctors. So the doctors are the ones that have told me, hey, maybe we should try this trial. So I actually wasn't aware of anything until I started meeting with the current doctor I have, and she explained all the options.
Got it. That makes sense. Well, yeah,
and
I
agree.
think, yeah.
Oh, go ahead. Sorry.
Oh no, you're fine. I was going to
Okay,
say.
I was just going to say, yeah, I get a lot of obviously all the emails from the MDA, and then just with my doctor always saying I'm interested in any type of study that you think I might be available for. I've participated in a couple natural history studies, so not necessarily therapeutic trials, but just yesterday I did spend a whole day in a natural history trial, and speaking with the kind of the trial coordinator, I just said, oh yeah, if this goes to the next phase, I'm definitely interested. I don't qualify now, but so just kind of making it known that you're interested in participating, and I'm sure if something comes up, they'll reach out to you, because I know oftentimes it's hard to find participants. So it's kind of advocating for yourself is important.
Mm-hmm.
Mm-hmm. Yeah, I think that sometimes with some of the providers that are kind of farther out in more rural areas or don't have all that information could benefit from, like Patrick, what you were saying about those resources, kind of bringing those to your physician and kind of letting them know that, this is what's going on if they aren't aware and such. But it's always good to have that just come directly from your doctor, which is great. Yeah. Anything else that y'all feel like would be helpful for others to know about that we hadn't gone over in the questions, as far as advice around things or strategy things or thoughts or ideas?
One
I
of the
know there was
things,
a,
go ahead,
sorry,
Don.
Nevin. I was just going to say, I noticed in the questions, there was a question about, for a younger person, like thinking about kind of what they want to do when they become an adult, right? As far as occupations. And I just think there's, obviously probably don't want to become a physical labor type job or a plumber or something like that. But like there's so many different opportunities for people to do. I wish I was doing what Nevin did, but I'm just a boring accountant. I'm a huge sports fan, so um, but just there's obviously think about kind of maybe how you're going to progress when you think about that. But I just think there's a lot of different jobs, especially another maybe good thing about the pandemic is I work from home mostly now, so it's much easier than getting up every morning and getting to work. That started to become more of a struggle, and now I can work from home. Um, so I just don't limit yourself just because of your disability, and but kind of think about where you're going to be in 15 years or 20 years when you're thinking about an occupation.
I was, I don't know on this call if it's all parents or adults with Becker, but one thing I would stress is if you're a parent, just be honest with your child from the start. It's just going to make things a lot easier down the road that they know what they're going through and that they can advocate for themselves, teach them right away, and teach them not to be afraid of having a disability because you will find out, as I have seen, especially at work, there are more people out there that are willing to help than people that aren't willing to help.
Mhm. Yeah, and I would say for the older gentlemen, if there's or patients, if there's anyone on, ask for help. Get comfortable asking for help. That's probably the one of the toughest lessons I had to learn. One of the things I had to get used to is, when you need it, ask for help. And what I've found is that most people really don't mind helping, and if they ask you to help, or ask you if you need help, let them help. I always say though, practice explaining to people how to help you, because we all get up in a weird way, or I don't say we all, but I know I get up in a weird way, and people always they put a hand out like they can pull me up, and thank you, that's not going to work. Let me tell you how you can help me. And I think that's part of it, just being able to ask for help and how to articulate how to help you without, because everyone likes help, but no one likes being dropped when you're being stood up. So I think as long as you can tell people how to safely help you, don't be afraid to ask for that help.
Yeah, I think that was all great. Any other thoughts before we go?
It's just nice to see the focus on Becker lately, the last few years. The Becker Education and Awareness Conference, Awareness Day has been fantastic. I've met more guys with Becker in the last 2 years through that than I think anything else. It's a terrific resource. So if you're able to get to one of those conferences, I highly recommend it.
Yeah. Well, thank you all for participating in the panel, and I will turn it over to Tess.
Yes, thank you, Patrick, John, and Nevin, for joining us today and for providing so many insights and being so open. We greatly appreciate your time. Let me pull my slides back up really quick. And Michelle, I do believe we have just a few questions for you, if you don't mind a few more minutes.
Sure. Yeah.
And John did provide some great insights with this first question that was in the Q&A that he had seen, but also would like to get your perspective, Michelle. Since BMD can occur in childhood, what do you recommend for school-aged patients in choosing future education and career paths?
Yeah, so I would definitely recommend getting connected with Division of Vocational Rehabilitation. So they're a service, like I said, it's in all states, and they start working with individuals around, I believe, 15 to 16 years old. They can kind of start with what they call transition services into exploration of employment and fit regarding disability issues. So that would probably be the first step that I would suggest as far as how to kind of figure out what the best or most longevity could be in professions. But it really is something that's it can take a while to determine what you're going to do for work. You're just able to focus a little bit more on the medical side of things if you connect with something like vocational rehab or someone within the medical system like a rehab counselor and such, because we can also see patients pretty young. So yeah.
Great, thank you. That's a wonderful resource. Just one more question for you regarding disclosure of disability. What does this look like if your disability is obvious or you use a wheelchair? What would that look like when discussing with your employer?
Yeah, so it kind of depends. If you need an accommodation during the interview process, then you could disclose at that time if it's important to do that. If you don't need one at that time, we still would recommend disclosing after the interview process because questions about disability and health issues aren't really appropriate to be coming from an employer in a job interview. And if they were coming out, there's certain factors to that and certain specifics that are not technically legal to be doing either. But then, in respect to needing accommodations later on the job, disclosure would be pretty common if it was necessary. But if it's not necessary, we still don't recommend disclosing.
Okay, thank you so much for that information, and thank you for your great presentation as well that provided a lot of information and for helping facilitate our Q&A today, or our patient panel. And thank you again to Nevin, John, and Patrick for your time and for sharing with us. We do appreciate you being here.
Thank you for having us.
Thank you very much.
Yes, thank you.
If you are new to MDA and have been diagnosed with a neuromuscular disease under MDA's umbrella, or if you are a loved one of someone who is diagnosed, we encourage you to stay engaged with us at MDA. You can do this by visiting mda.org/join and completing a short form. Joining is free and will keep you up to date on the latest research, educational programs, and supports. MDA has ongoing webinars, live virtual learning programs, and live events that may be of interest to you. We encourage you to take a look back at MDA's community education programming from 2024. We hosted over 20 virtual learning events this year that are now available for on-demand viewing. We also have many new access workshops, print materials, next step seminar opportunities, and helpful information on our website. Be sure to check our webpage frequently by scanning the QR tab at the right of your screen or visit us at mda.org/care/community-ed. MDA would again like to thank our sponsor, Edgewise Therapeutics, for partnering with us to bring you today's webinar. We would love to hear your comments about today's webinar. Once you leave, a web page will automatically pop up with a short survey. Completing the survey will provide us with important insight as we plan for future educational programs. If anyone has questions about this webinar, please feel free to contact MDA's Resource Center at 1-833-ASK-MDA1 or email resourcecenter@mdausa.org, and we will be sure to get back to you. Thank you again to Dr. Patterson, as well as Michelle Taylor and our panelists for sharing their time, insight, and perspectives with us. And thank you to everyone who attended today. This will conclude our webinar. Have a great evening, everyone, and we will see you again soon.